Alright, then this is the second part of the video of Professional English in Use, chapters 5 to 13. I will be reading the exercises from 10 to 13 in this part of the video. So for Unit 10, complete the sentences, look at A opposite to help you. Children over 60s and people with some chronic diseases do not have to pay a prescription charged in the UK. Patients with mobility problems may be unable to go out. They are housebound. The average GP surgery is 10 minutes ago. A primary care, a lock-in is someone who takes the place of a staff member who is on leave. Care outside working hours is known as out-of-hours treatment. Make word combinations using a word or phrase from each box. One word can be used twice. Look at A and B opposite to help you. Make appointments, refer a patient, run a clinic, take messages, supervise a clinic, change dressings, perform a minor surgery, make home visits. Which member of a practice team would be responsible for each of the following? Look at B opposite to help you. Running a clinic for pregnant women, midwife. Teaching a patient how to straighten his broken leg, physiotherapist. Letting the GP know that a patient can come to her appointment, receptionist. Running a clinic for people who want to lose weight, practice nurses. Visiting a patient who has just returned home after a hernia operation, district nurse. Carrying out checkups on children in a poor neighborhood, health visitor. Organizing cover for an absent doctor, Blackham. Complete the diary for Dr. Stewart's afternoon. Look at A and C opposite to help you. From 1 to 2 p.m., practice team meeting over sandwich lunch. From 2 to 4 p.m., afternoon surgery, 12 10-minute appointments. 4 to 4:20 p.m., coffee break. 4:20 to 5 p.m., check with reception for messages, deal with home prescriptions, and repeat home visit requests. From 5 to 6 p.m., paperwork, sign prescriptions to secondary care at my tax, telephone calls to patients, private medical examinations. 6 p.m., phones switched to auto service. Over to you. Okay, then. Exercises for Unit 11 match these activities to the stages of medical education in the UK given in A opposite. Dissecting cadavers, 2-year foundation program. Keeping a log of surgical procedures observed and performed, undergraduate. Working for 4 months in accident and emergency to experience this specialty, postgraduate. Taking a 4-week attachment in obstetrics and gynecology, undergraduate. Taking an online course recent developments in cardiovascular disease, continuing professional development. Complete the sentences. Look at B and C opposite to help you. Just before the final year, students have the chance to take an elective in a hospital of their choice anywhere in the world. Problem-based learning contrasts when approached where each subject is taught separately. These days lectures are often interactive with regular opportunities for the students to ask questions. In clinical attachment, students learn how to treat and manage patients. Students' selective nodules and modules can be a topic for outside medicine, such as foreign language. Dissection of cadavers is an important part of the anatomy component. She is a postgraduate at the Royal, one of the leading pediatric heart specialists in the country. The Royal College of Surgeons in Edinburgh dates from 1505. We have a seminar each week where we discuss topics in a small group with our lecturer. Match each of these activities to one of the components of the undergraduate course described in B and C opposite. July spends 6 weeks working in a small hospital in the Himalayas, overseas elective. A group of students discuss together the possible reasons for abdominal pain after meals in a obsessed 44-year-old man. Problem-based learning. A small group of students trace the pulmonary artery in a cadaver dissection. Otto spends a month working in a pediatric ward of the local hospital. Clinical attachment and learns how to take blood from an elderly patient. Clinical skills. Juma chooses to study travel medicine for a year. Student selected model. Then we have exercises from Unit 12. Complete the phrases with verbs from the box. Two phrases can be completed in two different ways. Look at A and B opposite to help you. Demonstrate a competence or how to do something. Supervise a trainee by ensuring she successfully completes her training. Deliver a course of a training program as a teacher. Take a course or a training program. Assess progress or competence. Match the two parts of the sentences. Look at B, A, and C opposite to help you. An FY1 is a doctor in the first year of the foundation program. A demonstrator is an anatomy teacher who teaches this section. A clinical trainer is a consultant who provides training during periods of direct clinical care. A supervisor is a consultant responsible for the training program of a trainee. A medical school is a part of the university responsible for medical education. A placement is a period span of training in a hospital or in a general practice. A college is a body of specialists responsible for delivering and assessing training in their specialty. A fellow is a specialist who has reached the highest level in their specialty. Write in full the qualifications of the doctors and surgeons. Look at C opposite to help you. Mr. A.H. John Husband, Bachelor of Medicine, Bachelor of Surgery, Fellow of the Royal College of Surgeons of England, Fellow of the Royal College of Surgeons of Ireland. Dr. C. Doyle, Bachelor of Medicine and Sciences, Doctor of Medicine, member of the Royal College of Physicians. Ms. E. Inglis, Bachelor of Medicine, Bachelor of Surgery, Fellow of the Royal College of Surgeons. Dr. E. Merriweather, Bachelor of Medicine, Doctor of Medicine, Fellow of the Royal College of Physicians. And then the last one is going to be from Unit 13. What kind of registration might these doctors obtain? Look at A opposite to help you. A newly qualified Spanish doctor. Provisional registration. A newly qualified Nigerian doctor. Limited registration. A doctor who has successfully completed the first foundation year. FY1. Full registration. An SHO who has successfully completed the foundation program and gained a certificate of completion of training after several specialist registered posts. Specialist registration. Write the abbreviations in words. Look at A, B, and C opposite to help you. Any doctor who wants to work in the UK must register with the GMC, General Medical Council. Some overseas doctors must pass the PLAB test before they can register. Professional and Linguistic Assessment Board. Part 2 of the test consists of an objective, structured clinical examination. In any emergency, remember the airways breathing circulation protocol. Before you can obtain specialist registration, you must have a certificate of completion of training. My name's complete the test. Look at A, B, and C opposite to help you. My name's Musa and I come from Yemen. I came to the UK about 2 years ago after graduating. Because Yemen is outside the EEA, I could only obtain limited registration. with the GMC at first. It was very difficult for me to obtain a place on a foundation program. Although I speak good English, I had to take the PLAB test to show that I could work safely in the UK. If I had to give some advice to other candidates, it would be that at counseling stations, you shouldn't simply memorize a set of phrases. It's better to really think about what you're saying to the actor and get the intonation right. After completing my year's clinic training, I was able to obtain full registration, but I found it difficult to get an SHO post in my chosen specialty. Pediatrics, as hospitals now have to demonstrate there isn't a suitable candidate from the EEA. Once I've completed my second foundation year, I should obtain a CCD, which will allow me to proceed to specialist registration with the GMC and an important step on the road to become a pediatric consultant.